We are good to go on my end.
Okay, I am recording. Okay, well, welcome guys. Welcome guys to the 9th meeting of Carroll PMC today. We're going to be interviewing some professionals in emergency medical services, otherwise known as EMS. And inform you guys about this. It's a great clinical experience opportunity, and it's a great way to get your feet wet in the medical field prior to going to medical school. Or making a career out of it, like many people have. So today, basically, we're going to go through some opening messages. You guys are going to get to then meet and hear some background information about some of the EMS professionals we have today. We, if time, we may run through a practice scenario, and then we'll have a quick question Q&A period of time, which you guys can ask some questions, and then we'll end just with a brief discussion about our next meeting, and then just some closing messages. Could we advance the slides? Whoever's in charge of that. Thank you.
All right, so our goal for this meeting is to inform, excite, empower, and involve all of you guys. As Andrew covered, this meeting is to really get some insight about the professional perspective from local EMS. And also to what's exciting about this is when we're successful, we'll walk away with more information about the opportunity of serving the community through being an EMS provider. And we empower all of you guys to bring ideas and questions, and also be attentive in the practice scenario, and also information that's provided. And if you have any questions or ideas for future meetings, we always welcome that. So for the COVID community update, there has been, as you guys might have seen in emails or news, a massive increase in total cases compared to recent weeks, with numbers jumping from 19,205 last week to a total of 24,818 in Montana. The county numbers increased the total in Lewis and Clark County by 247 from last week. And the total deaths in Montana increased by 64, with 2 being reported from Lewis and Clark County. On another note, for important information, if you guys haven't seen already, we have officer applications for junior officers. If you have any questions about that, please let us know. The link will be resent again, if not already. And with that, please welcome Spencer Tredick and Trevor Davies.
Nice. Yeah. Come on over here, boss. Okay, cool. So hi, I'm Spencer, the basic EMT here on St. Peter's Ambulance. This is Trevor. He's a critical care paramedic here. He's got way more experience than I do, that's for dang sure. And there's a handful of others over there that might swing in. Participate. Yeah, we'll see what happens. They're also on duty, so they might get a call and have to leave. So we'll see. But yeah, so at least you'll be stuck with me. So a little bit about myself. I'm from Hamilton, Montana. I went to school over in Bozeman for a couple years and decided I wanted to go somewhere in the medical field. Thought about doing radiation therapy. And so wanted to build up the old medical resume, much like you guys, some of you probably are. So I decided to go the EMT route as opposed to like CNA or something like that. EMS just sounded a little more fun. So went and did that, and here I am. And that's pretty much where we're at. So haven't quite decided yet if I want to go career, do like paramedics or something like that, or if I want to go back to school and do nursing or radiation therapy or something like that. Still deciding on that. So yeah.
You done?
I am. Yeah.
Okay. Like I said, I'm Trevor. Been doing this coming up on 15 years now, 14 of which was being a paramedic. Shashio.
What?
I've done a little bit of everything. Did fire. I've been a flight medic for a couple of years. Came back to the streets. So yeah, I just really enjoyed doing the education thing at St. Pete's. That's why I'm kind of helping this guy out. Kind of in the same boat, maybe looking at a career change in the near future, maybe nursing, maybe PA. I don't know what I'm going to do. Maybe time for a change, but that's about where I'm at. Oh, yeah.
Yeah.
Well, someone gets something thrown at them all the time by me.
So, yeah, I'm entirely unsure what my talking points for this slide were. Maybe they were stuff I already said. But yeah, just.
Did you make this?
Kind of.
Oh,
Yeah,
okay.
I added to it. Yeah, we, most of us just either got into this to build up a medical resume or because we're doing, volunteer fire department or something like that, and enjoyed it a ton. So they came on to make it a career and become a paramedic or going to be a PA, stuff like that. So getting certified. So for me, it was as easy as taking a semester of college. I say as easy as that. It takes a little bit of effort, but way more to be a paramedic. For me, it was just a semester. Did that through the Helena College here in town. As far as I know, I don't know if they're doing one this year or next year. I'm not sure. They're kind of in the middle of restaffing that. But there are other options out there as well to do that. And then from there, there is a national registry. And so there's a practical exam and a written exam. And so you got to pass those on the class to get certified, and then get certified in your chosen state, whichever that one is for you guys when that time comes. And then another semester of school, go on to be an advanced CMT, which just enlarges your scope of practice, things you can do. And then what is it, another year, or
It's
kind of varies?
It kind of varies depending on where you're at. So kind of when I started, there was no degree program with paramedic. That has since changed. You can now get your associates in paramedicine, which a lot of us at our department have. So you're looking anywhere between 12 and 18 months to get your associates. And then much like the same thing, like Spencer was saying, we do have to do a written test. You have to do a practical test. The only real addition thing is for paramedics, there is a true internship where the A's and the basics, it's more of an experience gathering thing, where the paramedics, you can't actually fail out of the whole program if you cannot pass your internships, which kind of vary anywhere between 3 and 6 months for internships, give or take. It's been a while since I've had a student. Yeah, 3 to 6 months for internships where you're pretty much a paramedic in charge, being watched and supervised by the other 2 paramedics, or a paramedic and his partner, to make sure you're competent and able to function on your own once you are deemed worthy to take the said tests. And kind of like the same thing with him, all of our licenses for the most part are national. So we have a lot of transference or transferable licensure across multiple state lines. It's even gotten to the point now with several states having compacts where if you get one license in one state, you're good for several other states too. So we're kind of getting away from more like the isolated Montana, Wyoming, Idaho, wherever you want to work at, to, hey, it's a compact, you get your license in one state, you're good for several other states too.
Yeah. It's a normal day in the life of EMS. I'd love to tell you that every call is one of those fun ones that you go lights and sirens and get to save a life. Most of what we do is not as exciting. It's still good. We still get to serve the community and help people in need. But we do a lot of lift assists. The fire department here in town has opted out of doing those. They just made that decision. Fantastic. So we do a lot of that. The life alert, help a fallen, I can't get up, which can be super important. Sometimes it turns into something a lot more than that. And that's kind of one of the big things is we joke around about it a lot. Like the dispatch information that we get is almost never accurate. They're like, oh, I have knee pain. You show up and they're, in a full cardiac arrest. So I don't know. It just kind of depends. Just day to day. I think we're running somewhere around. It's anywhere from like 3 to 5 calls a shift. So like
3 to 5 calls per ambulance per shift, not
Yeah.
3 to 5 calls
That's
for the
what I
county.
meant. Yeah. No.
Yeah, so our service right now is, I think, going to hit 6,500 calls in this year. So we're on par. We've had days where I used to work nights, no calls in 12 hours, and I think I tied this earlier this year for the record of 33 between me and 2 other ambulances. So
Yeah.
it was a bit of a toasty day that
It was a
day.
busy day.
Yeah.
And then the rest of our time is usually spent writing reports. Hence why I tossed on that lovely picture of a guy getting angry at a desk. Because that's a lot of what we do as well, is writing reports and things like that. We also, our ambulance office is stationed out of the ER. So we do a lot of help in there if we can, if we got time. Anything from just helping them out, cleaning rooms, or doing IVs, doing EKGs, anything like that to help them out, especially when they're having the super busy day. Because sometimes they'll be absolutely crazy busy, and we will not have that many calls. So we'll go in and help them out as well. So what goes through our head on a call? That's
There's a lot of jokes about that.
yeah. Kind of depends, call to call. I suppose the main thing that probably goes through my head right when I get on scene, depending on what the call is just I want to actually figure out what's wrong with the patient. Because like I said earlier, the dispatch information can sometimes be varied. You know, I've been on people where get dispatched and they're like, yeah, I have massive abdominal pain. You get there and they're like, what? No, my stomach doesn't hurt. And you're like, all right, sick. What's going on? So probably, scene safety, BSI, that's all super important. But I also just care about like what is actually going on with the patient. I want to get with the patient so that I can find out what's actually going on and go from there. I don't know if that is pretty solid.
Pretty solid
I
answer.
just want to get eyes on the patient and see what's going on.
Thing is, us being a lot of our department being paramedics, we have a lot of AEMTs, which have a pretty well expanded scope here, as well as our Bs have a pretty good expanded scope. So more the medics are, is it kind of coming in, does it need to be paramedic-y level things, really heavy ALS, or does it become more scene management, kind of figuring how we're going to get people out of where they need to go? Because majority of our calls, we have the fire department there, so we have anywhere between 2 and 10 guys there. So kind of more of us trying to wrangle them up, trying to figure out what's the next step besides getting from their house where they're at to the hospital. What do we got to do in between here and there? And being hospital based, we do quite a bit of stuff for the sake of the ER to give them a hand. Other places, not so much, where it's all like you have to have a real true and good reason. But for us, like an IV and abdominal pain, really don't need to do it, but they're going to get in the ER. Might as well just do it in the field while we're at it if we're not going to give meds. Just kind of help our ER out to help expedite the treatment care plans.
So yeah, just go from there. So looking forward, as I said earlier, for me, I haven't quite decided if this is a career path or not. To be determined. I definitely want to expand my scope of practice and get more education, just so I can do more for the patients who need it. Just using this as kind of a stepping stone at the moment to get into other things. Hey, doesn't mean I'm dipping out anytime soon. But so we're getting some good experience in the field and in the ER and things like that. Kind of meeting people on what can be the worst day of their life and trying to help them through that and do what I can with my scope of practice to maybe help them not die. That would be that's preferred, but patient care. Yeah. That's pretty much me looking forward. Haven't quite decided on that yet, but I'm really enjoying this for the time being.
Like I said, I don't know. I'm still kind of in wishy-washy mode if I want to make this my permanent career. I might go back to flight. I might do nursing. Ultimately, I would like to get into some form of management, but who knows? Still kind of enjoying this somewhat. Take it from there. Like I said, I pretty much pinned out my credentials and licensures as paramedic. So next step, going to something bigger and better.
Yeah. Any other questions you guys have for us? Happy to.
Do we want to do questions now, or do you want to run through a scenario now?
Yeah. It's up to you guys. I figured, I mean, we've gotten this far without a call. Maybe might as well run it now and then just save the questions for after that? Do you guys want to do that?
Yeah, we can definitely see what we can do about hopping into one. Hopefully we can get through.
Okay, if you guys want to coordinate about that for a couple minutes, and then maybe one of you just answers maybe a few of the questions that we have in the chat right now, we can go through, like, there's 3 posted right now. Do you want to answer those, and then we'll get.
Yeah.
Okay.
And
Can you see the questions?
I can. All right. So the difference between an AEMT and an EMTB with endorsements. That is an excellent question.
They got rid
What's
of
that?
is it nomenclature again? I still call myself an EMTP. And I
Either
also
way.
have about 7 years.
Yeah, basically that's just knowledge-based. Not quite sure. I think advanced EMTs can give a couple more medications.
Yes. So advanced EMTs can give several more medications. They have a basic interpretations of EKGs, if I remember correct. They can tell you what it is if it's a basic one. They can start IVs. They can give some basic medications where an EMT is pretty much, I hate to say it, Band-Aids and driving.
Band-Aids and driving. Well, the EMTB with endorsements.
Oh, with endorsements.
Yeah.
So the basic the EMT with endorsements is more of, you've taken individual classes along the lines of like being able to put a King Airway in, some basic medications, not as many as the A, IV skills. There's one more. There's Narcan. There's one after Narcan, but I can't remember which one it is. I thought there was one more now.
No, that's the only 3.
There's one. I don't know.
Yeah.
Smacks, whatever.
So yeah, basically.
You took classes instead of going back to school for a semester.
Yeah. So like for me, I just I did my airway endorsement class and my IVIO endorsement class, and so that was just when I was on shift. Luckily, I was able to do that with one of the guys here. And so rather than going to a whole nother semester and learning more about pathophysiology and all those things. Yeah, that's kind of the difference, a little bit deeper knowledge about the human body and things like that. What does history taking look like typically?
Nothing. Yeah.
Can EMTA push drugs?
Certain basic drugs, yes.
Yeah. Different things. We include like oxygen and saline and stuff like that as drugs, and then they can also do. They can do Narcan. They can do epinephrine.
Narcan, Epi, Benadryl, albuterol only, right?
No.
Bioneb, so albuterol and Atrovent. Morphine auto-injectors.
Right.
Yeah, so morphine auto-injectors, but they don't make those anymore, really. So a couple of more basic drugs, nothing. And nitrous.
Which I think is really cool.
Yeah. But nobody carries nitrous.
As far as history taking, are you talking about just like getting a history from the patient, or?
I think that's what was meant by that. Yeah.
Okay. Yeah. So typically, I have found that it's usually more related to what's going on. So say they're having like difficulty breathing or something like that. I care way more about if they have any history of like CHF or any other lung problems, anything like that, asthma, COPD, way more than I care about if they've had like a knee surgery or something like that. So for me, it's kind of a little more pointed and acute, more like what have you had happen in the past that's kind of related to what's going on now, and kind of using that to hopefully help you, figure out if this is the same thing that's happened before or something different or related to that. So it's not always as perfect as, the NREMT textbook, find out everything and what their mom had and everything like that. It's more kind of specific to what's going on with them. So yeah, hopefully that answered that decently well. What are some other ways to get certified in Helena besides the Helena College? So right now they're doing a class out of East Valley. the East Valley Volunteer Fire Department's doing an EMT class right now. And I know there's some over in Missoula and Bozeman and places like that. Great Falls, that Deer Lodge. They're starting one. Yeah, so it kind of just depends. So basically, the one that happened with East Valley, they just kind of put it out there. They were like, hey, we want to run an EMT class, and figured out who all was interested in that. And as long as you have a certified instructor to run you through the course, and then you got to get a national registry people out there to do the practicals and things like that. And then you can schedule your written exams through any. There's a number of organizations. Take it easy, Lori. I did mine through the Pearson View place here in Helena. It's basically just like a, walk in to like a closed room with like audio and visual, so that you don't cheat and stuff like that, and then take care of that. So yeah, it just kind of depends on what's going on and who might be running one. And usually, once they get the teachers kind of sorted out at the Helena College, then they'll probably be running basic and advanced classes again. And then as far as paramedic, I think you got to go. I don't think they have one in Helena. You got to go either Great Falls or.
There's no programs for paramedics right now in the city. A sit-down class in Helena. The ones the state offers are Kalispell, Great Falls, Billings, and Missoula, of all places. Just started a new program too.
Yeah.
What several of our other employees in our department and other places they've worked have done online, sort of a program out of UMBC, Boston, Creighton does one. We do the majority of your class is tele-learning, so kind of like what we're doing now, so there's no falling asleep. You actually are in like a group, just like a Zoom meeting. And you wind up going to different cities around the United States to do your internships and your clinical rotations.
So yeah. Did you jump right into working at St. Peter's, or did you work elsewhere after getting your cert? For me specifically, I just got certified in January. I took the EMT course last fall, and then I got hired here at St. Pete's in May. So this is my first EMS job at the moment. Trevor's had a few, so
I've done a little traveling with it. So I started off in San Diego, worked down there for the majority of my career, got tired of living the California lifestyle, went to Bozeman, didn't like Bozeman, took a flight job for a couple of years, kind of got bored of that, kind of fell into Helena, working at St. Pete's, and kind of rekindled my love for the job quite a bit.
Yeah.
So I've been here for about, 3.5 years, I think now, coming up on 4 years.
How long is a typical shift? So for us, we run 12s. So we do either 7 to 7 or 6 to 6 day or night shift. And then there's a few others that we have for covering other times of the day that usually have a higher call volume. So we do 12-hour shifts here. Other places I know do either 24s or
24s, 48s. A couple of really rare outliers will do 72s, but those are pretty much all being kind of scaled back now.
Yeah, so it kind of just depends on where you work, on how they have decided to run their schedule and how many crews they have on and things like that. So, but here at St. Peter's, we do 12-hour shifts. I know at Eagle Ambulance, Andrew, you are at Eagle. You could probably speak more to their scheduling. I'm not quite sure what they work.
Yeah, it kind of depends with Eagle. You can be on for, usually the minimum is 12s. I work 215s, so you can do 12s, 15s, 24s, 36s, and then the biggest is 48s, which is what most of our paramedics do. So it varies at Eagle.
So yeah, it just kind of depends on where you work, I suppose. Was it difficult getting hired? For me, a little bit. I had to apply 5 times before I got an interview, and I crushed the interview. So here we are. They're stuck with me now, so that's fun. Medics, most of the time, people need medics. So as long as you are competent and things like that, as long as you're alive and have your certs in order, it's usually not overly difficult, but depending on where you go, if they have a surplus of medics there, maybe. But EMS world also has quite a high turnaround rate, just based on a few different things. So there's most of the time there's always positions open. Just about getting in there and interviewing well is important. Things like that. So yeah. I don't know if you have anything to add to that.
Not really. No, it's more now just getting through. Once you get hired, we're kind of revamped our training program. So just because you get hired doesn't necessarily you're going to make it through your 6 months. So
yeah,
we're kind of trying to raise the bar quite a bit around here. Job availability.
Jobs available here at St. Peter's. I'm not actually sure if we have EMT jobs.
Negative.
I don't know. Well,
Huh?
You would think so, but I don't know if there's any posted.
No, I don't think any posted for EMTs. Medics, there's a ton of posting for medics.
Yeah.
So right now, there's a nationwide shortage on paramedics. Unfortunately, golden dollar rules everything. Paramedics are notoriously underpaid. So a lot of people are finding it difficult to get the motivation to become a paramedic, to put yourself through a year to 2 years of school to get an associate's, to wind up making $17 an hour. The people that do make it through, they don't have a really long lifespan. I want to say the average lifespan of a paramedic, not St. Pete's is an anomaly, is about 3 years. And then you gotta move on to something different. So having most of our department here being more than 3 years is pretty dang rare.
So, yeah. But what's that? We have 2 per diem EMT slots open at the moment. And that is basically you don't have any scheduled shifts that you work on a regular basis. You just get pick up shifts or get it maybe assigned one. I think you have to do like one a month or something like that, right? It's per diem.
I don't know.
I don't know.
I don't know about you guys, but on the floor at St. Pete's, per diem is 3 shifts a schedule, a 6-week schedule.
Yeah,
Okay.
I think
Yeah.
So I would assume it would be the same.
it's probably close to the same as that.
Yeah, pretty similar. So we have a couple shifts open, for EMTs. And you can also, I don't know if the ER is, you can always check out and look at the OR or the ER. They sometimes need EMTs as well, or techs or things like that. And they do make more than us, so that isn't a bad option. Like quite a bit more. That's the tough truth about EMS. We don't get paid very well, but hey, it's fun. Here we are. Does St. Peter's ever take nurses along for calls or transfers? We don't, that I know of. What's that?
No.
We're not licensed.
Yeah.
No.
So no for us.
No for us. That's the thing with critical care is it kind of gets us this bridge licensure for what we can and can't do. It does give us some expanded scope on certain things that kind of supersede what a nurse can do, but it also holds us back a little bit. But it is very rare, if ever, we'll take a nurse for a call or a transfer with us. Namely also because with licensing and stuff like that, practicing in and out of the hospital, orders and non-orders, things like that kind of get a little wishy-washy on stuff. Where pretty much everything we do is written through state standing orders, medical director standing orders. We only have, I want to say, 1 drug as paramedics that we have to ask to give or get clarification on giving, and it is a very rare drug to give, and I can't remember off the top of my head what it is. Because it's probably collecting dust in my drug kit.
Most likely, yeah. I know that if you are a PA or something else, you can be hired as a paramedic.
You have to become a paramedic.
You have to become a paramedic. Yeah.
Okay.
You
But-
can challenge the exam.
Yeah.
I see.
You don't have to
Okay.
go.
So if you're a PA, you don't have to go to the paramedic schooling. You can just challenge the exam, become a paramedic that way. But as far as bringing nurses along, we don't do that. So, yeah.
Cool.
We-
You guys want to start a scenario or demonstrate a scenario for us now?
We absolutely do that. Yeah, for sure.
Just
Give
give us
me
that.
just a sec, and we'll get one sorted out for you.
That sounds good. Yeah. And by the way, one quick thing: do you guys have any contact information for East Valley Fire for that EMT class for the spring semester? Is that going to be offered again?
No, I don't believe so. No, I think that was kind of a one-off thing at the
Yeah.
moment, so that they just kind of through together. As far as if they're going to run another one or things like that, or if another volunteer department's going to run another, I'm not sure. Yeah, it's if you are looking into doing like EMS or something like that, or you're just building your resume, it might not be a bad idea to check out some of the volunteer fire departments and things like that. And that's pretty solid little way to build up the resume, get some good experience that way as well, and then kind of be a little easier to stay in the loop as far as what's going on there. Because call it what it is, I don't even know if I knew that course was starting until they were like already started, and I was like, oh, that's sweet. They did an EMT course out there. That's fun. So yeah, kind of just depends on who you know. So
Of course.
all right, well, give us just a sec, and we'll see if we can toss something together for you guys.
Sure. Sounds good. Appreciate it. Yeah, and guys, like they were saying, volunteer fire is an excellent opportunity to kind of get your feet wet in emergency medical services, and just responding like a first responder. It's a great way to get your feet wet in it, and a good precursor to getting to becoming an EMT. So I don't have specific resources for that. I know a lot of people who may have the resources for that and who have experienced that, and I believe Roman may have some experience in that as well. Please reach out to us or speak to us afterwards if that's something you're interested in. And I don't know about the other officials, but I would be happy to reach out to some of the people I know to get you guys information on that.
I do know that during the summer, not summer, like right before spring semester ends, there's usually a table in the cube with the local volunteer firefighter departments around Helena. So they would be a good booth to get info from. But there's one in like East Helena, the West Valley, the East Valley, I think Montana City. There's a lot of them. So you can also find all that information online.
And if you guys have any more questions throughout the scenario, please just comment them below. We should have enough time to get a couple more in before we have our closing remarks. So just like you guys are doing, just comment them down in the box below. And really briefly too, just to fill the silence, there's as far as job opportunities at Eagle, since that's where I work, there are interests in providers at an EMT level and at a medic level as well. We have a company website that I don't believe it's linked to our Moodle page, so I'll link that up there. But you can always feel free to, if you do have your license, you can always apply, and your application then goes directly to our manager and will be considered. So that's the one opportunity I know about. I know Boulder Ambulance is also a volunteer ambulance located in Boulder, Montana, which if you just take I-15, you'll pass Montana City and it's the next one. Boulder Ambulance is in desperate need of EMTs to be volunteers there as well. So you could always reach out to them as well. I believe that, yeah, they have a Facebook. That's how I contacted them. So that's another option. But really, there's a lot of other volunteer agencies around Helena and also in the outskirts of Helena too that you guys can reach out to. Again, it's kind of about what you make of it. If you reach out and bother people enough, you'd be surprised at what you can get. Bother people politely though.
I also think it is important to note, like Spencer said, how it took him 5 times applying to get his job. St. Pete's can be very difficult to get a job at no matter where you're applying, and part of that is due to their system. And applications will get lost sometimes, and it takes usually like a month from the day you apply to even get an interview. So if you don't hear back, just keep applying. Like I think I applied to St. Pete's 3 times before I got my job. I mean, got an interview and then got my job. So that's the difficult part with it.
And some of the opportunities too that they also mentioned with an EMT license, if there aren't jobs available, you can always be a tech in the emergency department. You can really be any type of tech. You could be a patient care tech, usually same day services tech. There's a lot of different job opportunities. If you scour the website, you'll see on the St. Peter's website as well. So there's a lot you can do with an EMT certification.
All right, team. Are we ready? Did we do good? Sick. I'll take that as a yes.
Good to go. Good to go.
All right, incredible. So this is Megan. Megan is another paramedic on St. Peter's. She's going to be a patient. So just kind of grabbing a few of the things out of the back of the rig that we would normally bring onto a call, like our monitor and our jump kit. Show you right quick. So we've got our nice Zoll monitor there. It's got all of our vital signs and things like that we can do. And our jump kit that has like IV medications, things like that. Manual blood pressure cuffs, things of that nature, some trauma dressings, bandage control, things of that nature that we can take. Nothing too crazy, just kind of important stuff. So you guys pretty solid over there? Yeah. Trevor needs just a sec. We're getting things kind of set up. I don't know if you can see her back there, but that's Jackie behind Trevor. She's also a paramedic.
Did any of the questions pop up? Or did you
We got most of them. We'll round back to the other couple questions that popped up.
while they're doing
While they're setting up, real quick, we'll answer. It looks like only one. That's sweet. What is the primary reason the turnover is so high in EMS? The primary reason I would say is pay, probably. But I don't know if you can. I haven't been doing this that long, but
I think that's true.
I think that's probably the
or just
primary reason.
burnout,
stress.
burnout in busy systems.
Yeah.
We have a pretty nice balance
Yeah.
here in terms of call volume. We are at least adequately staffed, if not overstaffed.
So, yeah, but I'd say that's probably the primary reason.
But not making enough money will lead people to look for other careers. For sure.
Yep. So, yeah.
Ready? Okay, cool.
Favorite part about being on it? They're still setting some stuff up. Ask as many questions you guys would like. What is your favorite part about being on an EMS team? I think that it is, for me, it's a lot more rewarding to serve the community in a very personal way. You know, we're seeing them on like the worst days of their life possibly, and we're, you know, in their house, and we're figuring out what we can do to get them to the ER so that we can get them to a higher level of care, rather than I suppose being kind of in one place all day, doing the same thing and doing very important things. I get to, you know, go all over town and drive the big wee woo bus, which is also a ton of fun. Yeah, there's a little more, it's a little more laid back and I don't know, the camaraderie is pretty solid with our crew here.
Tugging at my heartstrings here, buddy.
Okay, let's go.
Yeah, let's do this.
All right,
Oh,
I think
you
we're ready.
feed
We'll
him?
come back to
Oh,
the.
you feed him information? Or are you being a provider? And I feed him information.
He's gonna
Jackie.
be my.
If you're the paramedic, I'm gonna feed him information.
Okay, I'm a paramedic.
Okay,
Yes.
so we are going to run. So we're gonna run a mock call of a dispatched out to chest pain. Just gonna go from there. So I will. Me and Jackie are gonna take this one, and Trevor's gonna feed us information. See if we can get Megan in view.
Oh, puppy.
All right.
All right. You're dispatched to unknown problem man down.
Unknown problem man down.
Yeah.
Oh, incredible. Okay. How are we doing today?
Oh, not well.
Not well.
No.
My name's Spencer. I'm with St. Peter's Ambulance. This is Jackie, my partner. What's your name?
My name is Megan.
Megan. What's going on today?
Oh, I got this pain right here. I was having a nap and it woke me up.
Woke me up. Okay. Yeah, thank you. What's that pain feel like? Is it like pressure? Is it like stabbing pain? Is it
Heavy.
heavy pressure?
Heavy.
Feel like someone's sitting on your chest.
Don't give leading cancers. Have her answer the question.
What's that?
Have her answer the question.
Okay. What does that feel like? Something sitting on your chest? Does it feel like
Just hurts, man.
it just hurts? Okay, yeah. Does that radiate
I just
anywhere?
get sweaty.
You're all
Does it
sweaty?
what?
Does the pain radiate anywhere? Or is it mainly in your
No,
chest?
no, it's right here.
It's right there.
Vital signs as to see him. Blood pressure. 146 over 78. 146 over 78 on the blood pressure.
Okay. And heart rate?
As you see it.
As I see it, 27. Okay. Yeah. Let's get over 40 and check that out at the moment. Do you have any history of any heart problems?
No.
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 You never had a heart attack before, anything like that?
No. I'm 34 years old. Of course I haven't.
Okay, sounds good. Do you have any other recent surgeries, anything like that?
Oh. Take one more.
Okay. Toss around 12. See what's going on here.
I'm sorry, how old are you again? 34.
Talking to your patient.
All right.
Can you help me?
Absolutely, yeah. We're just trying to figure out what's going on with your heart real quick. We will.
I can't take this pain.
How's your breathing doing? Are you having any difficulty breathing?
Yeah,
Is it hurting when you're
my
breathing in?
chest. My chest.
Yeah. Patient care, Spencer.
Patient care. All right. Well, I'm going to give you some aspirin.
Before that, are you allergic to anything?
No.
Incredible. So we'll do some aspirin. We'll start there. Just have you chew those up. Incredible. All right.
My mouth is dry.
All right. You think you could?
I feel so sweaty.
So at this point, we move her to the back of the ambulance. We're just going to stay here for now, but we're in the back of the ambulance. I'm going to go ahead and give you some oxygen.
Why?
Just to help with your breathing a little bit. I'm not going to actually put it on you. Because it's, yeah. What are we seeing, Jackie?
Stunning inferior wall.
What? A what?
Inferior wall stemming.
What does that mean?
It just means that you're having a pretty solid heart attack. We're going to go ahead
What?
and take you up to St. Peter's and get you helped out.
I'm having a heart attack? Are you kidding me?
It's okay.
Me, I'm having a heart attack. Never tell your patients they're having a heart attack.
do that.
So
What if they ask you though?
I will never say that because I'm wrong. Often.
What if they're having a stroke? We know they're having a stroke. And they say, "Am I having a stroke?" You say, "Yeah, I think you are."
That yes, but heart attack I've been wrong too
Is
often.
it appropriate?
You have a stroke and a stroke.
Be honest with your patient, but
Yeah. What if they say?
just because
What
the
if they ask? Could this go?
You're having a
Yes.
cardiac event.
Yeah.
You need to get
So
help or to get you to the
Yes.
hospital.
It's sometimes
Yeah.
12 lead,
Yeah.
but
Like-
does not look normal to me. So you need to go ahead
I
and-
mean honest, always be honest with your
You don't look at the
patients.
monitor and go, "Holy shit."
Correct.
Hey, you know I go, huh?
Oh, you got that.
No, I go,
We have the oxygen.
Okay.
Back into it.
Focus.
I'm gonna go ahead and give you some nitro.
So what?
Some nitroglycerin. It's just gonna help your cardiac output. It's gonna be good. Don't even worry about it.
All right.
It's gonna be good.
And yeah, and then we're going to hop in the ambulance. We're gonna pick you up and get you checked out.
Okay.
Perfect.
Heart attack.
All right, so not perfect, but here we are. And that's more or less what that would look like.
Would normally not be ran by a basic.
Yeah, that's also another thing. I probably would not have been in charge of that call as long as I was. So, but hey, we made it happen. We were there. So yeah.
What does that patient need from a paramedic?
What's that?
Diesel therapy.
Diesel therapy.
Like our trauma patients.
Yeah.
They didn't need
What's that?
our trauma patients.
Yeah.
You know,
They didn't have Band-Aids.
the ones that we had, you could have taken with endorsements.
Yeah, so I would have had my IV. Yeah, at the time. So.
What else did these guys say?
All right.
Oh, that's
So
a
that's
lot of questions.
more or less what that looks like. It's probably a little less, but here we are. Okay.
Kano.
You could show them that.
Yep, tell the script.
Yeah. So this is they had a little machine that helps, or it what's the word I'm looking for?
It's called an EKG.
Well, yeah, but it
The 12 weight.
the machine they use to not symbolize to
Simulator.
simulate what STEMI would look like, which is just a pretty solid heart attack. So this is exactly what it would look like. It prints out of the monitor and it has all your leads and everything. It shows you what's going on at different views of the heart. So yeah, there's that. Does St. Pete's help pay for EMTs to become paramedics?
No.
No,
No.
but maybe.
No.
No, but
No.
absolutely not.
No.
They
No,
Nope.
absolutely not.
Nope.
okay. No, I'm getting a firm but fair no from everybody else.
They have an employee assistance fund, but you only get $1,000 a year.
That's
I
a
think
drop
that's
in the hat.
why they're saying no to me, even though I know that they do help a little bit, although
Yeah.
it's not much.
They give 1,000. When I got my license, it was $15,000 to get my license.
Here's the books.
It's not even that. Here is half of your textbooks.
What does the dynamic look like with the fire department responding to medical calls as well? So depending on, for the most part, I'd say they get there first. So they are the first to have eyes on the patient and to kind of start the process of figuring out what's going on. And then we have a pretty solid relationship with our fire department and our QRUs. So we get along pretty well, and they've kind of started an assessment and hand off to us, and then we kind of all just work together here. We work together pretty well to just kind of do what's best for the patient for the most part. So,
Oh, EKG questions.
what signs on the EKG do you look for in a suspected heart attack? What changes to the PQRST are you looking for? What is your policy for NSTEMIs? That's
So,
all you, boss.
Yeah.
Yeah.
Thanks.
I know most to nothing about
Yeah.
that. I know a little bit.
He
but
knows it
not-
goes up and
not
down.
much.
Sometimes we'll go left to right.
Yeah, I know that
So
there's
what we're-
waves.
What we're looking for is EKG, and as far as EKG interpretations for STEMIs, we're kind of going along the lines of DAF definition, ST elevated myocardial infarction. So we're looking for at least one small box of elevation with according reciprocal changes along your congruent leads. As far as our policy goes for NSTEMIs, unfortunately, we don't have an ISTAT. So if we think they're having a STEMI, they, honestly, I'm going to be kind of frank here, they look like crap, pale, cool, diaphoretic, kind of on death's bed, but their EKG is coming back looking fairly normal. We have a really good working relationship with our physicians. If we think it's a STEMI or an NSTEMI, we can give them a jingle and go, hey, Dr. Phelps, I think this guy's coming in. He looks real bad. I think he's got an NSTEMI. They'll do the NSTEMI workup and have a bedside ISTAT with a troponin I as soon as they can. But along those lines, if we think it's a STEMI or an NSTEMI, depending on how far away we are, morphine and or nitro drips, morphine pushes to kind of decrease that preload and afterload, trying to maximize that oxygenation to the heart is pretty much what our end goal is. Again, like Megan was saying, as paramedics, in traumas and STEMIs, anything like that, what definitively need is they need physician intervention, so cath lab or a surgeon.
You heard it here first.
Yeah.
How superstitious are you all? Oh, the
Oh,
EMS
God.
gods are the worst. Yeah.
Yeah.
Absolute worst.
There
yeah.
are words you don't say.
Yeah, absolutely.
There's certain people you don't work with because you know you're never going to catch a break.
Yep, absolutely.
That was me and Bill today.
Yeah, no, it's decently
Yeah.
superstitious.
That is
yeah.
the understatement of the century.
Yeah. Yep. So, yeah, there's a good amount of not saying things.
Yeah. Implying.
Not upsetting the EMS guys.
Yeah, it's a lot of implying.
So, yeah, exactly. Yeah. So that's any other pressing questions?
Words today.
I know. Yeah.
Ah.
I'm trying. Yeah.
More than one syllable.
Hey, got to throw it one every now and then, you know. Yeah.
Any other questions, you guys? Anything you guys got? Yeah. Okay. It doesn't look like it. So, guys, I appreciate it so much for doing this today. Yeah, no, that was great. I think that gave people a lot of insight into the field. So we appreciate it.
That was the most like mediocre,
Moderately okay.
Moderately okay mock medical call, but hey, give it a shot. So yeah. So Josh said something about it was as far as getting in touch with the fire department.
So if you're looking for the volunteer fire departments to get in touch with for an EMT program, if they're still providing them, the Lewis and Clark Rural Fire Council has a list of all the fire departments, as well as all the contact people for like the training officers and things like that. To go along those lines of trying to find an EMT class. I know right now with the restructuring of the college, it's going to be a little thin trying to find a program here, at least regionally. You might be able huh? Yeah, but they're probably not going to do another one anytime soon.
They don't do one
Yeah.
for every 2 years.
Yeah, because a lot of these volunteer fire departments do it rarely as an outreach program like East Valley's doing, but they usually do it, hey, we're jumping on as a volunteer. With the fire department, it's kind of becoming unanimous that you need to at least be a basic. So they'll provide the program for you that way. But trying to get in contact with the Rural Fire Council will probably be another avenue to try and track down. I hate saying names. Best Practice Medicine. They're a private out of Bozeman. There's a area medicine out of Missoula. Deer Lodge. IMME out of Bozeman. Great Falls, I want to say, does a program. So pretty much in all the outlying surrounding cities, there is some facet of an EMT program. We're just kind of lacking right now with some restructuring at the college.
Okay. Great.
Yeah.
Yeah, appreciate that. Okay. Thank you, guys.
Absolutely. Yeah. Happy to help out.
Mm-hmm.
Thank you, Spencer, and everyone else.
Pleasure.
No problem.
All right. Go eat dinner.
Come on,
All right.
yeah, nothing else on the fishing report.
Okay. Where are the slides? I lost them.
I'll do it.
Sorry, guys. Cool. Okay. Perfect. Okay. Does whoever made this slide want to speak about it?
Yeah, so basically there are some ideas that we were throwing around, and we wanted to open the floor to you guys if you had any ideas as well. But some ideas for next meeting may be like how to submit a strong applications, and we can bring in a recent accepted medical student or an individual who is currently their first year and who recently applied. And another could be what is your why and how to find it, and the officers can have a panel just talking about their why. Or another thing could be an invitation for an admissions committee from a local medical school we can reach out to come and speak. if there are any of these that interest you or others, we welcome those ideas for future meetings. So yeah.
Yeah, I'm gonna piggyback off what Michael said. Just to kind of give you guys a little bit of future look into the future. We're planning on likely having about 3 more meetings for the semester. It's coming to a close very rapidly, and it's terrifying, but it's reality. And so most likely our last meeting it might be on the 12th. We're going to give the week before finals as no meeting because we're all going to be studying. So likely we'll have about 3 more meetings, with the 12th being a good portion of that one dedicated to some final last minute resources. Probably a brief little bit a discussion about the junior officer positions, and then just some last minute things and resources before we get really into the depth of the finals week. So that's just to give some future reference, but yeah, please, any meeting ideas, you can even stay after, you can comment them, whatever you'd like, or email them to us for those next meetings. We want to do things or organize things and reach out to people that you're interested in and might explore. So great. Yeah.
Yeah, basically to really tailor it towards your guys' interest and wants. And as Andrew mentioned, definitely if you're interested, apply for the junior officers and do that when you have the opportunity to. And as a closing note, recognize that every interaction you have is an opportunity to make a positive impact on others. So, yeah, with that, thank you guys. Have a great week and weekend. Good luck on any exams you may have. And yes, get the Lysol wipes out and don't forget to wipe down your area and that laptop. So, yeah, take care.
Thanks for mentioning that, Michael. Yeah, take care, you guys. And if you have any questions, stick around. We're happy to answer them. Have a great evening.
Thank you.
Thank you.
I have a question.
Yeah.
What would being a junior officer entail?
So what we were thinking is next semester, junior officers would start slowly transitioning into their roles. So like they would be mentored by the current position. And then basically next year, you guys would take over the club, since 4 out of the 5 of us will be graduating. So that way you're not like thrown into it the start of next year and being like, well, how do we run a club?
Okay.
Yeah. And it'll be a gradual thing. The way that goes is we used to have the re-elections and the new roles be fulfilled in April. That's along lines with AMSA. However, we're kind of steering a little bit away from them at this point. So we're still figuring out how it's going to go. But like Kayla said, it's going to be more of a basic mentoring, a lot of mentoring about the positions and what it'll look like for next year. So that's what we're looking at right now. Yeah.
It's a great, I think we mentioned numerous times, but I think it's a great leadership opportunity just to be able to give back and share your own experiences. So, yeah. Did that kind of answer the breadth of that question?
Well, what would so it would just be like planning the meetings and planning the activities and things like that, running the club probably next year.
Yeah. So as Kayla mentioned, and as you kind of touched on, was really seeing the individual role you may be interested in, like organizing the meetings, having officer meetings, or just communicating and setting up the meetings or events or speakers even, and reaching out to the community to really get connected and bring in crucial and important information for students that are in the pre-med community at Carroll. But roles being, I think Kayla and Andrew can speak more if they want to add to that.
No, yeah, I think that's great. Like, I know one thing specifically, like whoever's going to be the secretary, I would show them the email list and like how to effectively, instead of like typing in 70 emails to everything, like what I add, how I do it, just a lot of stuff like that. That way next year you guys don't feel like you were thrown into the dust and the club runs smoothly.
Yeah, and y'all probably be facilitating some meetings in February or March, at least to a certain extent. It'll be an active process too. It's not just going to be like some like paper job intern like thing. It'll be, we'll keep it interactive, and honestly, it's going to evolve. We aren't exactly sure yet, but the gist of what we've been saying so far is what at least the skeleton of it's going to be. It's what the foundation of it's going to be. That could change, and it could grow into blossom into something other stuff too. So yeah.
Sweet.
Yeah. Thanks for asking that.
Yeah. Just have 3.5 years left, so it's like,
Yeah.
I waste time.
Yeah, why not? Yeah, definitely jump into it, and we'll definitely look forward to reviewing your application.
Okay.
Yeah. Take care. Have a great night.
You too.